Good morning. I'd like to welcome everyone and thank you all so much for being here as we announce and celebrate today the first annual Oklahoma Healthcare Quality Week. I'm Melissa Hill with OFMQ, and I'll just quickly go through our agenda and introduce our speakers this morning. Again, thank you for being here. So we wanted you to hear today from representatives not only from OFMQ, but also others who have, unique perspectives on healthcare quality in Oklahoma. So from OFMQ, we'll start off with Dr. Lytle. He is our medical director. He'll be followed by Gregg, OFMQ's CEO. Very, very pleased and honored to have the Lieutenant Governor Todd with us today. Thank you so much for supporting our event this morning. And then two other guest presenters will make some comments. LaWanna Halstead, who is the Vice President for Quality and Clinical Initiatives with the Oklahoma Hospital Association. She'll be followed by Dr. Mike Crutcher. Very pleased to have you here, Dr. Crutcher. He is the Director of Medical Quality with Variety Care, the state's largest federally qualified health center. So, we have a broad representation of support for healthcare quality. I want to also appreciate a couple of others that are standing with us today. Our two state nursing home trade associations are here. Becky Moore with the Oklahoma Association of Healthcare Providers, and then Mary Brinkley with Leading Age. So again, part of the reason we invited folks to stand up was really just to show that healthcare quality is not just OFMQ's issue. It impacts everyone here in Oklahoma, and it truly is a partnership across all provider settings. And so with that, after our formal presentations, we'll have a few minutes for questions and answers for you, and then we'll be hanging out for a few minutes afterwards for some photo opportunities and maybe some individual conversations as folks' schedules will allow. So again, thank you for being here, and with that, I'll ask Dr. Lytle to take the podium.
Thanks. Well, besides being the medical director of OFMQ, I'm also a member of the organization called the National Association of Healthcare Quality, or often referred to as NAHQA. And NAHQA was founded back in 1975. And part of its goal is to be a strong supporter of healthcare quality workers throughout the country. And in Oklahoma, there are some 60 members of that organization, but there are many more quality workers, quality professionals throughout all our hospitals who are doing this kind of work. The issues regarding the safety of healthcare are big issues. Ever since a sort of landmark book in 1999 to Err is Human, we've been aware of the fact that medical errors cause a real problem. That book came out and talked about 98,000 deaths a year that might be related to medical errors. Unfortunately, I think over the last decade that number has probably increased, maybe even doubled. And almost half of those are from things like hospital-acquired infections. So across the country, some 20% of Medicare patients who are in the hospital when they're discharged are readmitted within 30 days. In Oklahoma, that's 26,000 Medicare patients readmitted within a month of their discharge. And that's some of the work that we're trying to work on with quality and trying to improve healthcare. The cost of medical things like that, medical errors, is some $17 billion or more a year. NAHQA started Healthcare Quality Week back in 1985 to honor the work of healthcare quality and patient safety professionals in their efforts to improve patient outcomes. Oklahoma Foundation for Medical Quality is proud and excited to be part of this, the first Oklahoma Healthcare Quality Week, to honor those professionals. Thank you.
Good morning. I'd like to thank everyone for being here in support of the first Oklahoma Healthcare Quality Week. We appreciate Governor Fallin and Lieutenant Governor Lamb for officially recognizing the importance of quality improvement as a critical component to making healthcare better for everyone. This is an exciting opportunity for OFMQ as we celebrate our 40th anniversary as a nonprofit organization dedicated to improving healthcare and improving lives. We are here today to publicly reinforce our commitment to quality improvement and to acknowledge the many partners and healthcare providers who contribute to improving lives. At OFMQ, we are continually encouraged by the progress that is made, but that often doesn't get publicized. I'd like to share some examples with you. Oklahoma nursing homes working with OFMQ achieved a 23% reduction in bed sores or pressure ulcers, and physical restraints were reduced by 76%. Many hospitals have successfully adopted new processes for reducing the occurrence and the spread of potentially deadly infections. With increased focus on quality improvement initiatives around surrounding patient transitions and discharge planning, we're seeing a decline in the Medicare 30-day readmission rate. Nearly 2,000 fewer 30-day readmissions were reported in 2011 as compared to 2009. In just the last 2 years, OFMQ has helped more than 1,000 providers begin the process of implementing electronic medical records, with nearly over 200 of them already achieving stage 1 meaningful use with their systems. Our experience tells us that by using EMRs, providers better manage the patient's care, especially as it relates to preventative services such as cancer screenings and immunizations. Currently, many people and organizations are working diligently to build an infrastructure to create a connected healthcare system in Oklahoma. We applaud this progress. We urge all health providers to embrace quality improvement as a priority in creating a safer and more cost-efficient system of care for our loved ones, young and old. For families and caregivers of aging and chronically ill loved ones, you also play an important role in healthcare quality. We urge caregivers to be engaged in healthcare, seek out information to help you know what questions to ask and what you can do to help keep you and your loved ones safe and healthy. Currently, there are many resources available to help. I offer our website at www.ofmq.com, or you may contact our office if you find yourself unsure where to start. We have a lot of work to do in our state. It's no secret that the state of Oklahoma falls behind in many health status indicators, such as heart disease, diabetes, obesity, and smoking. I'm saddened by these statistics, and I know many of you in this room are also saddened by them. OFMQ wants to do what we can to make a difference. Changing healthcare is hard. Changing behavior is even harder. We certainly don't have all the answers, but we can together make a difference. As we see more and more evidence that diligent efforts to improve quality leads to better health outcomes and lower costs, we must keep working. It takes dedication and resources to put best practices into place, to collect data and to measure quality, to use technology to improve care, and to identify barriers to quality and develop workable solutions. We see and feel the strain that providers are under today, and we want to hope to encourage those who, in spite of the limited resources, can rise to the challenge and to pursue better quality in healthcare. With today's announcement, we celebrate Oklahoma Healthcare Quality Week, and OFMQ salutes the progress, the dedication, and the support we have in our state to make healthcare better for everyone. Thank you.
I'd like to now invite the Lieutenant Governor to come for a few comments.
Well, thank you for allowing me to participate today in this very important announcement, celebration, recognition, awareness, why we are all gathered here in the Blue Room. It's a pleasure for me to represent Governor Fallin as she is out of state. And as I was standing up here, I was thinking about my time in the state Senate, and the first committee that was under my authority when we had that very unique tie in the state Senate of 24-24 was the Health Committee. And what I learned very quickly, what I appreciate about this announcement, was that I had a lot to learn when it came to healthcare and the industry and the needs and the issues represented in our great state. And what is represented behind me and actually in front of me is the team. So many different individuals representing your area of expertise in healthcare, which will be the only way we move the ball forward in Oklahoma. Well, we talk about our economy, we talk about education, any other policy issues, but particularly healthcare. It will require a team effort to bring the experts together to talk about that quality of care, accessibility of care, providing care to our citizens. So I'm thrilled to participate in a small way today. The proclamation of Oklahoma Healthcare Quality Week is an acknowledgement of the importance of healthcare quality improvement efforts in the state to improve care for everyone. We're here today to celebrate professionals who practice healthcare with high ethical standards, honesty, integrity, and accountability. Quality improvement professionals play an important role, too often behind the scenes, to impact health, safety, and well-being of patients. Many types of healthcare providers are represented here today, from hospitals, nursing homes, home health, and physicians. I thank you for being here and to stand for quality improvement. Today, with OFMQ's help, providers in Oklahoma are breaking down institutional silos, so important, to develop better ways of coordinating care for patients as they move through the healthcare system. This work can ultimately help people avoid a costly hospital stay, manage a chronic condition, avoid a harmful or potentially fatal prescription drug event. Health information technology is an important tool to improve patient care. Goals that have been stated or alluded to: better care, healthy people and communities, and affordable care for our citizens. We all want and expect healthcare services that meet professionally recognized standards of care. We all want that. Healthcare quality professionals are dedicated not only to ensuring standards are met, but also that we are making progress toward these larger priorities. As I close, I want to acknowledge and I appreciate the progress being made in our state. We've made so many advances economically. We've made so many advances in education. We've made so many advances in so many public policy arenas. But again, it has already been mentioned and why you all have taken up the call of serving in healthcare in different capacities, because we still lag behind, unfortunately. And we rank high in categories where we don't want to rank highly in. But we're making progress, and we're making progress because of that team effort. I encourage continued focus on driving improvements that will lead to better health care for everyone, from Oklahoma seniors to tomorrow's generations, which will benefit the entire state of our great state of Oklahoma. Thank you.
Good morning. I'm LaWanna Halstead, the Vice President of Quality at the Oklahoma Hospital Association. And I would be very pleased and like to thank OFMQ for inviting us to be a part of this event and to recognize Oklahoma Healthcare Quality Week. Ensuring patient safety and quality is a never-ending job for Oklahoma's hospitals. Today, patients that are admitted to the hospital are increasingly complex. Hospitals must maintain the highest degree of diligence while assisting patients in returning to their highest level of health that they can achieve. Hospitals are constantly raising the bar and striving to implement new initiatives to improve their processes. In Oklahoma, hospitals are being increasingly innovative in their approaches to create systems that ensure greater safety and improved outcomes. For example, most Oklahoma hospitals are participating in the Partnership for Patients National Patient Safety Project. Hospitals across the nation and here in Oklahoma are working together to share best practices to prevent infections and other adverse events that can happen while patients are hospitalized. Hospitals are using technology to improve safety. For example, decision-making medication programs are used to alert clinicians to medications that don't work well together. Scanners are used to assure that the right medications are given to the right patient at the right time. Special beds can alert staff if a patient is unsafely getting out of bed. Technology will continue to play an important role in the safety of patients. As large volumes of data are studied and experts determine the most effective and efficient treatment protocols, hospitals build evidence-based guidelines into their care delivery systems so that appropriate interventions happen in a systematic way. Much like pilots do in the airline industry, hospitals have implemented checklists that clinicians review before surgeries and procedures. They observe timeouts or pauses to allow time for everyone involved in the procedure to orient themselves to each other, to each person's role, and to the specifics of each case. Also, hospitals are working both internally and with other care providers in their communities to identify ways to assure that patients' transition from the hospital to the next level of care is successful and does not result in a setback or even perhaps a readmission to the hospital. And I would be remiss not to mention the recent work the hospitals have done to protect our youngest of patients. In the past 18 months, hospitals in Oklahoma that deliver babies have come together to assure that mothers and babies receive care that provides the best outcomes for both. You probably know that a full-term pregnancy is 40 weeks. However, in the past 15 years, we've seen a national trend that has resulted in more babies being born at 38 weeks than at 40 weeks. There's a mounting supply of evidence that earlier births result in complications for newborns, including respiratory and temperature difficulties, often causing them to stay in a special care nursery unit. It's also known that during the last few weeks of pregnancy, the brain experiences a significant amount of development, and so it's important that babies not be born too early. Through an initiative named Every Week Counts, the hospitals and physicians have changed these statistics in Oklahoma. When we started the initiative in 2011, the rate of babies being born at less than 39 weeks without a documented medical reason was 8.12, and today we have decreased that to 1.75, and we continue to work on that. Hospitals are also implementing processes to educate new parents about safe sleep practices, injury prevention for babies and young children, and promoting breastfeeding, which we know will improve the immune system of babies and decrease the chance of childhood and adult obesity. On another topic about improving health, I'm sure that you know that Oklahoma has one of the highest prevalence rates of tobacco use in the United States. We know that smokers do not heal as fast as non-smokers, and the use of tobacco causes more complications during illnesses and procedures. Because of this, hospitals are taking a leading role in the prevention of and the cessation of tobacco use. They are implementing system-wide interventions to assist patients and families in quitting. Finally, hospitals collect data as a way to continually monitor their progress toward goals and help them identify areas in which they need to improve. With the goal of being transparent and giving as much information to the public as possible, many websites have been developed to give information about clinical processes and outcomes to the public. The okhospitalquality.org website offers easy access to publicly reported quality measures for Oklahoma hospitals. I want to thank you for this opportunity to promote improved quality of care. It takes all of us working together to bring the highest level of care and patient safety to all Oklahomans. Thank you.
Well, thank you. I want to thank OFMQ for putting this together and for asking me to be here today. And again, my name is Mike Crutcher, and I'm the Director of Medical Quality at Variety Care. She said, as Melissa said, it's the largest FQHC or federally qualified health center in the state. And I've stood at this podium many times and talked about the health outcomes of the people of Oklahoma, and I think we all know what those are, and we don't need to revisit those. Those have been mentioned here a couple of times today. But what we're here to do today is to talk about the health of the systems in which we deliver health care in Oklahoma. And I'm very happy as I kind of get toward the end of my career to spend my time working on that because as I'll make a comment at the end of this statement is that there is no reason why Oklahoma should have any less effective healthcare system than any other state in the union. And I can't accept any excuse why we can't be there. It's been mentioned earlier, I think Glenn brought up the issue of this debate really began back in 1999 with the publication of the book To Err is Human, and shortly after that with the publication of Crossing the Quality Chasm. Both of these were books by the Institute of Medicine, which really called out the healthcare system and said what we are doing in delivering healthcare in the United States is not as good as it could be. And it said, here's the things that we need to do to get better. So we've been striving to do that for the last 12 years now. So it's not a new issue, but fortunately it is, I think, gaining a new level of momentum now. Now, what those two reports ultimately said were, these are the problems with the healthcare system. This is what we need to fix. And I don't think any of you are going to be too surprised by these. First of all, it is too expensive. In the United States, we pay twice as much per capita per health care than any other industrialized country. And I'm sure the Lieutenant Governor knows well the cost of Medicaid expenses to the state of Oklahoma, and at the federal level, the cost of Medicare expenses, and it's something that we have to get control of. Number two, it is not equitably distributed. If you have access to the healthcare system, then you get pretty good care. If you don't have access to the healthcare system, then it's another ball game. And that is something that definitely we as a country need to fix. It is inefficient and often wasteful. It is not optimally effective. We're not really getting what we pay for. For the dollars we're paying, we ought to get a lot better health outcomes than we are getting in this country. It is often not safe. It is disjointed and unorganized, not a unified system. It is not patient-centered, and it has an insufficient number of primary care providers. I don't think any of that is a surprise to anybody here, is it? And ultimately, what the report says is that everybody that works in healthcare in the United States needs to ensure that all Americans receive care, and this is really the mantra of the report and drives a lot of the policy that is going on today. All Americans should receive care that is safe, effective, patient-centered, timely, efficient, and equitable. Again, hard to argue against any of those things, and that should really continue to be the mantra of what all of us are working towards. And so to summarize all of that, I think ultimately what our challenge for all of us that work in healthcare is this. It's to transform a fragmented, fee-for-service, volume-driven, provider-focused system that is very expensive and unsustainable into a coordinated, team-focused, outcome-based, value-driven, patient-centered system that is affordable and sustainable. Now that's a mouthful, I know, but it summarizes basically what we're all trying to do. And ultimately, we're trying to move from a sick care system into a true health care system. And so that's a lot. There's a huge amount of work to be done. I will say that right now, if you want to kind of categorize the bodies of work, which is driving most people today to achieve those, you can summarize that into two things. One is to continue to move towards the meaningful use of electronic medical records. We have to be fully digitized and be able to communicate across organizational boundaries if we want those things to happen. And two is for organizations to pursue accreditation as patient-centered medical homes, or at least pursue the philosophy of the practice of patient-centered medical homes. And I know many of you in this room are indeed doing that. One other comment that I will make about an effort at the national level that I think all of us should be aware of comes from the Institute for Healthcare Improvement in Boston. And it's referred to as the triple aim of healthcare improvement. And this is just another kind of way to categorize the challenges before us in healthcare. Aim number one, we have to work to improve the experience of care that patients receive, providing care that is safe, effective, and reliable to every patient, every time. Number two, we need to work to improve the health of the population to assure that we are practicing the highest level of care that is evidence-based, that is delivered at the highest rate possible to every patient that we interact with, that we're delivering the right care at the right time. And finally, the challenge is to decrease costs. And many of the things that we have talked about previously hopefully will help us decrease costs. So improving the experience of care, improving the outcomes of care, and decreasing the costs of health care. So those are the challenges before us, and they are many. But again, I refuse to accept that we in Oklahoma do not have the initiative, the will, the courage, and the energy to do that, just as every other state pursues those outcomes. And finally, let me just say that one thing that is happening here in the state, and I want to recognize OFMQ again for certainly assisting in making this happen, is a relationship that Variety Care has with Integris and with OU here in the state related to transitions of care. And this is all about improving those interactions and coordination between healthcare facilities that we've talked about many times as not being very good. So Variety is working with OU and Integris, two of the largest healthcare systems in the state, to make that better, to assure that when patients leave those hospitals, that they get quality care in a community setting, and that we make that communication and transfer of information work to the betterment of the patient's care. So I'm very happy to be involved with that. Variety certainly wants to be a leader in that effort in the community, and I want to thank OFMQ for the opportunity, and well as for OU and for Integris. And I appreciate all of you do to make Oklahoma practice the highest quality health care in the country. Thank you.
on behalf of OFMQ, I want to express sincere gratitude to all of our guests who spoke this morning. And hopefully you all got a taste of the scope of quality improvement initiatives in different provider settings and across the state of Oklahoma.